The government's COVID-19 measures of holding in quarantine those returning to the country from abroad and those believed to have been in contact with positive cases at quarantine facilities continues to be a major headache. Delays in testing and the backlog in sampling the specimens collected from those in quarantine is causing disquiet in some of the facilities. At the KMTC facility at Mbagathi, 126 individuals are now demanding to be released, claiming that they have overstayed at the facility, as Kenya recorded 72 new positive cases, bringing the total number of cases to 2,093.
At KMTC Mbagathi, the center can no longer hold those who have been placed in quarantine, especially those who traveled back to Kenya mid-May want to go home. Their grievance? They were tested on Wednesday, 27th May, and after 6 days, they still do not have their results.
Tumenyamaza all those days, hakuna mtu anatuambia anything.
Tumekuja same flight na watu wako Kise, KMTC Karen, KMTC Kise. Same flight na St. George's. Same flight tumekuja na wao. Sisi tumepimwa mbele yao na wao wamepimwa nyuma yetu na wao wameondoka wameenda zao nyumbani, lakini sisi bado tuko hapa.
Health officials were called in to quell the rising tension. This center has been mostly for individuals who had traveled from different countries. Penina, like most here, traveled from Dubai, the United Arab Emirates.
And we were supposed to complete our 14 days on Friday. From Wednesday until now, no one has communicated to us about our results. We are wondering, why are we being kept here? Yet, there are people coming in from other countries when we are still here, tested, no results, and we don't know their status.
Sasa sisi imefika hapa kikomo, sisi tunataka tutoke hapa mahali, na kama si leo ni kesho, na kesho itakuwa hata tutoa, tutatoroka kwa nguvu zetu sisi wenyewe.
Huwezi kuuliza kuwa ati where are the results, alafu daktari anakuambia nenda uulize serikali. Who is the government if it's not them?
The depression, stigma and uncertainty on whether they tested positive or negative is taking a heavy toll on them.
Wanasema tupimwe tena within 2 minutes tupewe majibu at the spot, which is not acceptable. Saizi sisi tunataka pass kwa nyumbani, hakuna mtu ambaye atapimwa tena.
Hakuna sample yoyote, walisema samples zimepotea, hatujui hizo samples zilienda wapi.
Hii maneno ya corona, akisema ya kwamba wenye pesa ni watatoka.
A similar standoff is at the Technical University of Mombasa. Here, those at the facility are complaining of double standards. They're also dissatisfied with poor sanitation at the facility. The Ministry of Health acknowledging that indeed there is a backlog occasioned by the shortage in reagent supply.
We may have a temporary snag in terms of these supplies, and that might have delayed the testing of some samples. We may have a backlog of samples that we need to clear. That could be one of the reasons. What I can assure you is that we are working on clearing up this backlog, because we also do not want to keep people in quarantine longer than they should actually be there.
Many who had their samples collected in the 2-week voluntary drive have not yet received their results. Against this backdrop, Kenya has recorded 72 new positive cases of COVID-19 out of 2,892 samples tested in the last 24 hours. This brings the tally of cases to 2,093. The distribution of the new cases is 39 in Nairobi, 13 in Busia, 8 in Mombasa, 4 in Kajiado, 3 in Migori, 2 in Kiambu, 2 in Garissa and 1 in Kisumu. The big question in the matter of urgency, especially for those in quarantine, is where are our results? When will we get them and how? With just above 2,000 positive cases of COVID-19 recorded in the country, mass testing still remains crucial to understand the true trajectory of the virus. But equally important is the relaying of the results, whether positive or negative, in good time to restore confidence in the testing process. Dorcas Wangira, Citizen TV, Nairobi.